Come on. Come on.
You are watching a Lee County deputy save the life of a toddler who had a seizure in her Lehigh Acres home. Her parents panicked and called for help after their healthy daughter suddenly stopped breathing. Natasha Casal shows us how a fever can lead to this kind of seizure in a baby.
She was just awake. Well, I get you, but she's not responsive.
Lee County Deputy Curtis Redford saves 1-year-old Catalina in Lehigh Acres. This life-saving CPR kept her alive until she was taken to the hospital. Doctors say she had a febrile seizure. Sophia French, pediatric neurologist at Lee Health, tells me.
So febrile seizures are one of the most common child neurology disorders that we see that counts for probably 2 to 5% of children will experience it.
Although for Catalina, it was a rare kind of case.
You typically only need to do CPR if they're not breathing and they don't have a pulse. So that's not something that we often need to do for febrile seizures because they typically stop on their own within 3 to 5 minutes.
This type of seizure happens to children between ages of 6 months and 6 years old, when a child is sick and typically will happen within the first 24 hours of a fever.
It's provoked by a fever. You can't have had an epilepsy diagnosis prior to that. And so if you have seizures when you're not sick, then it doesn't count as a febrile seizure.
If your child is experiencing a seizure, here's what you should do. Roll them on their side, have their head pointing down so vomit or drool can drain and prevent choking. Never put something in the child's mouth that might hurt them. Also call 911. And keep this in mind, these seizures can run in your family.
They do tend to run in families. So if you have parents who had febrile seizures or siblings who had them, then maybe your parents should keep a closer eye on you when you're sick. But there's no screening or testing you would do to see if someone's at risk for febrile seizures.
Typically, children who experience a febrile seizure will experience this once in their lifetime, and in other cases, they are given medication. In Fort Myers, I'm Natasha Casal for Gulf Coast News.